Police Sergeant Thomas Becker was dying in the intensive care unit at Charité Hospital in Berlin, while 20 of Germany's best doctors were left in the dark about his diagnosis. Poisoning, unknown infection, autoimmune disease. No one could understand what was killing him. Then Anna Hoffman entered the room. Handcuffed, her orange prison uniform from Plötzensee prison stood out among the white coats. A former neurosurgeon struck from the medical register for negligent homicide. She was there for her monthly medical examination. When her trained eye fell on the dying police officer, she immediately noticed what 20 specialists had overlooked. A tiny puncture behind his left ear, almost invisible. She recognized the symptoms of a bite from the European Black Widow, but there was something even more threatening. The doctors looked at her with contempt when she dared to speak. How could a criminal explain their work to them? But when Anna described the progression of symptoms with millimeter precision before she had even seen the medical records, silence fell over the room. They had less than an hour to save him, and the only person who knew how was the woman in chains. The October light fell harshly on Berlin, Neukölln, revealing every crack in the dilapidated buildings, every discarded syringe in the corners. Police Sergeant Thomas Becker knew these streets like the back of his hand. 10 years of patrol duty in Berlin's most difficult districts had taught him to smell danger in the air. On this Tuesday afternoon, the abandoned building on Sonnenallee seemed quieter than usual. Too quiet. Thomas entered with his service weapon drawn while his colleagues stood guard at the patrol car. On the second floor, he found what they were looking for: a drug-cutting lab, tables full of white powder, precision scales, all the packaging materials, but not a soul in sight. As he documented the scene with his cell phone, he felt a sharp sting behind his left ear, an annoying sting that he attributed to a piece of flaking plaster. He didn't see the small black spider with the red spots scurrying away along the wall. Minutes later, as he finished the search, the cramps began. First slight muscle contractions, then increasingly violent spasms. Sweat beaded on his forehead despite the mild October temperature. As he tried to walk down the stairs, his legs suddenly gave way. The impact alerted his colleague, who found him semi-conscious, his body shaken by uncontrollable convulsions. The ambulance raced to Charité Hospital while Thomas's vital signs went haywire. His blood pressure was through the roof, his heartbeat was irregular, and his pupils were fully dilated. He alternated between moments of clarity and feverish delirium, talking about giant spiders crawling over his skin and screaming that his blood was burning in his veins. In the emergency room, Professor Michael Kraus immediately called together all available specialists. Within an hour, 20 of Berlin's best doctors gathered in the conference room. Each had their own theory. The toxicologist suspected a new synthetic drug. The neurologist leaned toward fulminant meningitis. The immunologist spoke of atypical anaphylactic shock. But no diagnosis explained the entire clinical picture. Meanwhile, Thomas's condition deteriorated rapidly. His fever rose unabated. His muscles contracted in such violent spasms that he threatened to break his bones. His heart beat so irregularly that cardiac arrest was imminent. The hallucinations became more and more vivid. He saw his 8-year-old daughter Lisa floating on the ceiling and heard voices calling him to the afterlife. Sabine Bacher arrived breathless with little Lisa. Through the glass of the intensive care unit, they saw a man they no longer recognized. His face was swollen and purple red. His body writhed despite sedatives. His eyes, when they opened, seemed not to see this world. The examinations followed one another feverishly. CT, MRI, lumbar puncture, complete toxicological screenings. Everything had changed, but there was no discernible pattern. It was as if Thomas's body was fighting an invisible enemy that was attacking every system at once. 6 hours after admission, the situation was critical. His kidneys were showing signs of failure. His liver was in distress. His heart was beating more and more irregularly. Professor Kraus had to tell Sabine the bitter truth. They didn't know what was killing her husband, and at this rate, he would not survive the night. Thomas's colleagues had gathered in the hallway, men and women who had been hardened by the streets of Berlin, now reduced to powerlessness. The ward was filled with an atmosphere of frustration and failure. 20 brilliant minds unable to solve the mystery while a man was dying before their eyes. In that moment of utter despair, the automatic doors of the emergency room opened to let in a prison transport vehicle. It was 9:14 p.m., a time that would be etched into the memory of everyone present. Anna Hoffman crossed the emergency room with steps restricted by chains, escorted by two correctional officers. The orange uniform of the Plötzensee prison could not completely hide the remaining dignity in her movements, even though her eyes told a story of decline and resignation. 3 years earlier, Anna had been a rising star in German neurosurgery. Her specialization at Johns Hopkins, her operations on pediatric brain tumors considered inoperable, her publications in international journals, everything pointed to a bright future. At 38, she had become the youngest chief physician for neurosurgery at the University Medical Center, Hamburg. Then came that cursed December night. She had already been operating for 14 hours straight, saving two children with complex malformations. When little Max arrived, 5 years old, with a rapidly spreading brain tumor, she didn't have the strength to say no. Extreme exhaustion had driven her to take amphetamines, not to get high, but to maintain the clarity she needed to save a life. But in the 14th hour of this impossible operation, her hand trembled. The scalpel deviated by 2 millimeter that severed a vital artery. Max died on the operating table while snow fell outside in Hamburg. The investigation was merciless. The use of amphetamines turned a tragic medical error into negligent homicide under the influence of drugs. 5 years in prison, revocation of her medical license. The end of everything she had been. In prison, Anna had become the unofficial nurse of the women's wing. The inmates respected her, coming to her for medical advice in minor treatments. She had saved at least 3 fellow prisoners from overdoses with her residual knowledge. But once a month, she had to go to the hospital for checkups for chronic liver disease, a consequence of stress and stimulant abuse. Sitting on the plastic chair in the emergency room, Anna immediately noticed the tense atmosphere. Doctors ranting, nurses whispering excitedly, the palpable energy of an ongoing emergency. Her medical instinct, dormant but never dead, automatically awakened. Through the glass doors of the intensive care unit, she saw the scene. A man in a police uniform writhing on the bed, surrounded by white coats. When the door opened to let more staff in, Anna had a full view of the patient. Her brain, trained by years of diagnosis, automatically began to process the visible symptoms. The pattern of muscle spasms was unmistakable, not random but rhythmic, with peaks of increasing intensity every 3-4 minutes. The redness of the skin was not uniform, but concentrated on the left side of the body. The sweating followed a particular pattern. She had only seen something like this once before. While volunteering in Brandenburg years earlier, when a nurse passed by, Anna couldn't help but ask about the patient. The nurse initially looked at her with contempt, noticing the prisoner's uniform, but something in the professional urgency of Anna's voice made her respond. She quickly described the symptoms: extremely high fever, hallucinations, progressive multi-organ failure. All tests were inconclusive. Anna's brain pieced together the puzzle at the speed she had acquired through years of emergency diagnosis. She asked if they had checked for insect or spider bites. The nurse replied that they probably had, but had found nothing obvious. Anna insisted that they had to look in specific places: behind the ears, in the crook of the neck, between the toes. She mentioned Latrodecus tridesmutatus, the European black widow, rare but found in Brandenburg. Its bite could cause exactly this combination of symptoms. The nurse rushed to the intensive care unit and reported to Professor Krauss. The professor initially dismissed the idea with an irritated gesture. How could a prisoner make a diagnosis? But Anna didn't give up. She stood up, her chains clanking, and shouted loudly enough to be heard that they should look behind the left ear for a tiny puncture mark that might look like nothing more than an insignificant red dot. At that moment, a resident rushed out of the intensive care unit and announced that he had found exactly that: an almost invisible puncture behind the left ear with a characteristic erythematous halo. The ensuing silence was deafening. The atmosphere in the emergency room crystallized in a moment of collective disbelief. Professor Krauss stared at Anna across the hallway, his professional pride conflicting with the urgency of saving a life. 20 doctors had failed to see what a prisoner had diagnosed from a distance. Anna quickly explained that with a genuine bite from Latrodecus tridesmutatus, They had less than an hour before the neurological damage became irreversible. The antitrodectus serum was the only effective antidote, but it required an extremely precise administration protocol to avoid potentially fatal anaphylactic shock. Krauss admitted that the serum was not available at the hospital, too rare to keep in stock. Anna immediately suggested the Robert Koch Institute, the only one in Berlin equipped to deal with exotic toxins. But even if they obtained it immediately, they needed someone who knew the exact protocol, calibrated to the time that had elapsed since the bite, the patient's weight, and the immune response. As they discussed, Thomas's condition deteriorated rapidly. His blood pressure plummeted. His organs were showing signs of imminent failure. Sabine Becker appeared in the hallway, her face ravaged, begging someone to save her husband. Krauss made a decision that would change many lives. He ordered the correctional officers to let Anna into the intensive care unit. After frantic telephone consultations with their superiors, they agreed under strict conditions. Anna would remain shackled and under constant surveillance. When Anna entered the intensive care unit, some of the doctors recognized her. Her case had been in all the newspapers. Disapproving whispers rippled through the room, but Anna ignored them and focused entirely on the patient. She approached the bed as far as the chains would allow and examined the bite with a trained eye. She confirmed the diagnosis. Definitely a black widow bite, probably about 8 hours earlier, based on the progression of symptoms. She explained that the venom of this spider works in 2 phases. Initially mild symptoms, which then explode when the neurotoxin reaches the central nervous system. But as she studied the vital signs and test results more closely, Anna noticed anomalies that did not fit with simple spider poisoning. Thomas's pupils showed a typical reaction. Some blood markers indicated the presence of another toxin. Sabine revealed that Thomas had been researching a new type of drug, something never seen before. Like this story? Give it a like and subscribe to the channel. Now let's continue with the video. Anna immediately connected the dots. Someone had deliberately used the spider as a delivery system for a cocktail of toxins, creating an improvised biological weapon. This discovery changed everything. The antitrodectus serum would only neutralize part of the problem. They needed a multi-pronged approach. The serum for the spider venom, high-dose benzodiazepines to combat the synthetic carcinogens that probably made up the drug. And Anna suggested something bold. Controlled therapeutic hypothermia to slow the metabolism and give the body time to eliminate both toxins. It was a risky procedure on a patient already so compromised. The doctors hesitated. Thomas himself, in a brief moment of clarity, whispered to trust her. The serum arrived in 20 minutes from the Robert Koch Institute. Anna directed each phase of the administration with the precision of someone who had never stopped being a doctor, despite the chains on her wrists. She ordered the serum to be diluted in a specific way to minimize the risk of an allergic reaction, which was exacerbated by the second toxin, to monitor blood pressure every 2 minutes, and to prepare antihistamines and corticosteroids. The infusion began under the watchful eyes of everyone present. The first few minutes passed without any side effects. Gradually, Thomas's blood pressure began to stabilize. The convulsions decreased in intensity, but Anna warned that they were only at the beginning. The next 6 hours would be crucial. The following hours were an exhausting battle against death. Anna remained in the intensive care unit and guided the medical team through each crisis with the calm competence of someone who had handled hundreds of emergencies. When Thomas's blood pressure suddenly plummeted in the 3rd hour, she calculated the exact combination of vasopressors needed. When his kidneys showed signs of acute failure, she determined the precise fluid balance to avoid an overload. Professor Krauss sat down with her around midnight, while the correctional officers took turns on surveillance shifts and asked how she had seen what 20 specialists had missed. Anna replied that they were looking for exotic diagnoses when the answer was relatively simple. They had ignored the small details. In prison, she had learned to notice minimal changes when survival depended on it, to perceive subtle mood swings in fellow inmates. Krauss admitted that medicine missed her, but Anna replied bitterly that medicine had rightly decided it no longer wanted her. She had killed a child under the influence of amphetamines. There was no redemption for that. Before Krauss could respond, the alarm sounded. Thomas was experiencing a side effect of hypothermia. His already stressed heart was struggling with the reduced body temperature. Anna ordered gradual warming, 1 degree every 20 minutes, with increased cardiac support. She then noticed an improvement in the EEG. Brain activity was showing signs of recovery. The toxins were eliminated. It was the first real sign of hope. At 3 in the morning, little Lisa was brought in by an aunt. Sabine had insisted that she see her father in case it was the last time. The girl asked Anna if she was a doctor, noticing her checking the monitors. Anna replied that she had been one a long time ago. When Lisa asked her to save her dad, Anna saw in those innocent eyes another child, from another time, who had made the same request. She promised to do everything possible. Lisa spontaneously took Anna's restrained hand to thank her. This simple gesture of trust broke something in Anna. For the first time in 3 years, tears ran down her face. At 4 a.m., Thomas's parameters improved significantly. His fever dropped, the convulsions had almost stopped, and his kidney function stabilized. But Anna warned that the critical phase lasted 48 hours. Delayed neurological complications could occur. As if to confirm this, Thomas suddenly began to convulse. Not the convulsions caused by the poison, but real epileptic seizures caused by the elimination of toxins from the brain. Anna immediately ordered anticonvulsants and guided the team through another crisis. At dawn, as the first rays of sunlight fell through the windows of the intensive care unit, Thomas finally opened his eyes. This time they were clear, present, conscious. He saw his wife, his daughter, then Anna. He whispered that she had saved him, but Anna shook her head. It had been the work of the entire team. Thomas insisted that he had heard everything, even when he seemed unconscious. He knew what Anna had done. He turned to the correctional officers and declared that this woman was a hero. The officer awkwardly reminded him that she was still a prisoner convicted of manslaughter. But Thomas replied that he knew what she had done in the past, but also what she had done that night. She had saved a husband, a father, a colleague. 2 weeks later, Thomas Backer left the hospital on his own 2 feet. His recovery was complete, without the neurological damage Anna had feared. As he walked out, surrounded by celebrating colleagues, his eyes searched in vain for a figure who was no longer there. Anna had returned to Plötzensee the same day Thomas was declared out of danger and disappeared quietly at dawn while the hospital was still asleep. But her presence had left an unstoppable wave in its wake. Professor Krauss wrote a detailed letter to the Ministry of Justice about Anna's crucial role in saving a public servant. Doctors signed a petition to review her case. The newspapers picked up the story with headlines about the disgraced doctor who had done what 20 specialists could not. At Plötzensee prison, Anna had returned to her routine, but something had changed. Her fellow inmates looked at her with new respect. The guards, many of whom knew Thomas, treated her with a friendliness that had been lacking before. But above all, something had changed within her. For 3 years, she had carried the death of little Max like a stone on her heart. Now, next to this picture were Lisa, who thanked her, Thomas, who opened his eyes, and Sabine, who cried with relief. A month later, Anna was called to the director's office. She expected a reprimand for a minor offense. Instead, she found Thomas in uniform, fully recovered, along with a lawyer. Attorney Zimmerman announced that the motion to reopen the case had been accepted. Thomas had conducted an investigation and discovered that Anna had been awake for hours on end on the day of the fatal operation. Forced by the hospital administration to operate despite her protests of extreme exhaustion. Overwhelming evidence of systemic failure came to light. Emails from the administration showed awareness of the problem, but considered it a necessary evil to keep productivity high. Other doctors testified that they had been similarly pressured to take stimulants to cope with impossible shifts. During the retrial, Max's mother did something unexpected. She approached Anna in the courtroom and spoke 2 words that changed everything. "I forgive you." She acknowledged that Anna loved the children she operated on, that she was just as much a victim of a broken healthcare system as her son. The court ruled and recognized the overwhelming mitigating circumstances. The sentence was reduced to the time already served. Anna was free, but physical freedom was only the beginning. The revocation of her medical license remained in place, preventing her from operating. 6 months later, however, the Ministry of Health offered her a special position, advisor for the safety of medical personnel. She could no longer operate, but she could teach, supervise, and ensure that no other doctor was pushed beyond human limits, as had happened to her. A year later, at the inauguration of the Anna Hoffman Center for the Well-Being of Medical Personnel, the auditorium was packed. Thomas and his family sat in the front row along with Professor Krauss, some former fellow prisoners whom Anna had helped, doctors, journalists, and representatives of the ministry. In her opening speech, Anna spoke of having touched the depths of despair, of knowing shame and guilt, of losing everything that defined her identity, but also of how the ashes of the worst failure can give rise to the greatest contribution. The center was dedicated to doctors who sacrificed their own health to save others, so that they would no longer feel alone in carrying this burden. Thomas approached her after the speech and reminded her that she had saved more than one life that day at the hospital. She had also saved herself and proven that a person's value does not lie in their worst mistakes, but in their ability to get up and continue doing good. The center's plaque bore a dedication in memory of Max Weber and all the patients who were lost not through lack of care, but through an excess of self-sacrifice. As the sun set over Berlin and illuminated the new center, Anna understood that the circle had finally been closed. From her lowest point, she had been reborn. Not as the brilliant surgeon she had been, but as a symbol that even the most tragic mistakes can lead to positive change. Little Lisa, now older, approached her at the end of the event and calling her Dr. Anna said, "Your father thinks you're an angel." Anna knelt down, this time without chains, and replied that she was just a human being who had learned that everyone deserves a second chance and that sometimes our worst mistakes can lead to our best deeds. 10 years later, when Anna died peacefully, thousands attended her funeral. Doctors and former prisoners, rescued patients, and comforted families, all united in memory of a woman who had turned her own tragedy into a mission to protect others from her own fate. The center that bore her name continued to operate, saving not only lives, but also the souls of those who dedicate their lives to saving others. Every year on the anniversary, Thomas Lisa, now a medical student, brought flowers to lay under the plaque. Anna Hoffman's legacy lives on in every hospital where doctors are no longer forced to sacrifice their own health, in every patient treated by rested and clear-headed doctors, in every second chance given to someone who has made a mistake. The story of the prisoner who saved the police officer became a legend in German medicine, reminding everyone that competence does not disappear with a conviction, that redemption is possible, and that sometimes it is precisely those who have fallen the deepest who have the strength and wisdom to save those who are in danger of falling. Because Anna was right when she said that we are not defined by our worst mistakes, but by how we choose to get back up. And she had gotten back up and turned her pain into a mission to ensure that no other doctor would ever have to choose between their own health and the life of a patient. Like, if you believe in the power of redemption and second chances, comment with your thoughts on this story of fallen rebirth. Share to remind everyone that anyone can make mistakes, but everyone deserves a chance to make amends. Subscribe for more stories that show how the brightest light can emerge from the deepest darkness. Because in the end, we are not defined by our worst mistakes, but by how we choose to get back up. And sometimes it is precisely those who have fallen the deepest who have the power to save those who are in danger of falling. True medicine is not only about healing bodies, but healing souls.